Welcome to The Last American Vagabond. I have a guest I've been looking forward to speaking with today, someone who's going to be talking about a topic that has been on my radar, but has been something that I've been really eager to dive into because it shows, I argue it shows the evolving agenda that's always really been there if this is something they're willing to do today, as well as a topic that I've been also putting off because I've been skeptical about that we're going to get into as well today. And this is investigative journalist Rosemary Frei. Thank you for joining me today. Frei or Fry?
Frei. Thanks,
Frei. Pleasure to have you.
Your name is Christian.
Yeah, it's funny. Funny I ask. It's Christian, technically Puerto Rican, okay. But I never make anybody say it that way because it's like I'm trying to be fancy, you know. Okay. Well, thank you for joining me today. This is a really important topic because of how this is evolving and because of it's right now we're in a discussion of the safety and efficacy of these vaccines that have been, experimental injections, that have been rushed, that have been pushed out for, you could argue under the guise of our safety, but there's a very real question about whether they are as efficacious as they're saying and whether they're as safe as they're saying. But now we're already on to the next discussion where they're saying, well, now there's variants. And to your point that you'll make, and we can discuss this too, there's no evidence whether these are actually more transmissible or actually more dangerous, but using that as a justification to say, we're going to just plug and play. We can talk about that for the mRNA vaccine style. The new variants will plug and play and make new vaccines, and we don't need to safety test them because we already did. So this is an alarming development. So why don't we get into that first, and you can explain what this, what this article is about, why this is happening, and why it's such an outrageous thing for you, why you feel it's so outrageous.
Well, let's step back for a second. There's first this new article that I posted last week, just before my most recent one that I posted this morning, is talking about the new regulations that are recommendations being put in place by regulatory agencies around the world, starting with the US and now the UK, Canada, Australia, Switzerland, and Singapore, saying that we don't need any safety or efficacy testing before putting new versions of these vaccines on the market for the new variants. And just step back, it's, do you want to talk, should we talk about the new variants, or do you want to go immediately to this?
Well, let's start with the new variants then, because that's a good logical place, because people are already afraid of these and thinking that these are something that, it's the evolution of where this is going. So the point I'm making is that they're arguing based, your article is discussing is that the argument is we're using the variant to plug in the new information and just using the new vaccine without actually testing whether that new version is even safe at all. So starting with the variant discussion, are these things something we should be concerned about, if you'd like to start there?
Sure, that'd be good. I posted an article on February the 3rd that was reposted in several places, including Off Guardian, talking about, are the new variants, is it true that the new variants are very dangerous? And this was in February, and there were three modeling papers, three most very influential modeling papers posted at the end of December from the UK about the B117 new variant, the UK variant. And I just thought, there's something, I might as well look into this. And I put those three papers in front of me, and I just took time to look through them. And I realized there were three key papers that underneath those are based on, that tie it all together. Those three papers ostensibly are showing that the one part of this new variant, the change in the protein that's in the main part of the virus that binds to the cell to try to get in, there's a change, they say, to this part of the protein, and that made it it made it more transmissible, more infectious, more easily, it binds more easily to the cell. But if you look at those three papers, they don't say that, at least not in any. They don't show that in people. At least one of them is they take yeast cells and they make them produce that part of the virus called the receptor binding domain, and they model that. That's pretty far removed from people transmitting it. It's like, and they say right in there, they say it's not this isn't a real life situation. And the other two papers are talking, I think they're in mice. So, and then none of them show that here's one mouse and he's got this new variant, or she or he transmits it to this other mouse. No, they don't show that. They just say, well, we put the virus into the cell, into the mice, and there were a lot of the virus after a little while. Okay, it's really quite It
sounds very scientific. Yeah.
Very scientific. Yeah.
Well, see, my big thing is that we've seen disagreement on this topic already from the very people we're told we're supposed to listen to. And sure, there's been different variants we're discussing. And I at this point, I question the validity of even the statements we're seeing. We can bring up one of the new recent ones we're talking about. But the WHO came out and said there's no evidence that the original ones we're talking about, I believe from the UK, is more transmissible, right? Is more dangerous. They said this themselves.
Okay.
NervTag, the organization.
Right. Okay.
The NervTag, the organization put together by the UK, also said the same thing, and they ended up listening to Neil Ferguson instead. It's just it's interesting that they're willing to push forward these things under the guise that they're absolutely more dangerous, even though there's disagreement within the official narrative. It just doesn't make any sense to me. What are your thoughts on that? Yeah,
it's clearly there's some bigger power driving all this. For example, in the article that I wrote about the modeling paper mafiosi, this is Ferguson and somebody else called John Edmonds, the chief architects of these really influential modeling papers. I included in there a paragraph about an article that came out in a German publication called Das Welt, or Das Welt am Sonntag, the world on Sunday, saying that they did freedom of information requests, basically, or they got information from a huge research institute in Germany that said that some really key scientists were told by the government last March 2020, that they had to put together modeling that would justify locking the country down. Wow. So, there's a whole bunch of questions that I answered. Well, why? Was there some sort of coercion of that government to be able to do this obviously treasonous act to their own people? The article in Das Welt doesn't touch it. Big questions, of course. Anyway, so in Germany, they got these scientists who did what they were told, and we have every reason to believe that the same thing has happened around the world. These models are just so divorced from reality and right. quickly are shown to be full of holes. And Ferguson's always been shown to be full of holes for his entire modeling career. He's the perfect person for that.
Sorry, I didn't mean to interrupt. I'm staggered by that. Like how we can stare at that and see the history and again choose to listen to the person who has a history of saying what ends up to be turns out being incorrect, let alone the beginning of this entire thing. I mean, the whole basis for the argument of 3.6%, I believe was the number, was coming from Imperial College and Neil Ferguson specifically. But here we are again, trusting that because it errs on the side of more power, more control to the whole biosecurity state. That's how I see it anyway. But here is something I tweeted about today, which I found really interesting. This is actually my tweet. Here's the tweet itself. Disclosed TV. Just in, French authorities are warning of another mutation. This time, a variant has been discovered that apparently escapes the detection by standard PCR tests. And as I said, laughing at this is the appropriate response. This is absurd. Endless wars meet endless pandemics. So what are your thoughts on that?
Well, I think it was maybe 2 or 3 weeks ago. I was talking to my girlfriend and I said, I bet the next thing they're going to do is have a variant that isn't detectable. And I got home and I looked, and there's a finished variant that's not detectable. So I don't know if this is the same one. I haven't seen the information you got, but so I contacted the scientists in Finland rather, who had said that they have this new variant. And I said, okay, do you have any information on it? Is there anything published? No, we don't have anything published. So it's okay. They can tell us anything, and
fearmonger, scare. Right? I mean, they can report about these things as if. I mean, I saw a report earlier a while back saying, this vaccine might actually fight cancer, and you look into it, you find out it's just an observational thing about somebody saying their cancer got better after the vaccine, and that's reportable, right? But it's if they're choosing to err on the side of these things are good, and that's just bad journalism. It really is. This one in particular stands out to me quite a bit because of the illusion around the PCR test itself, which is something that kind of brings us into this next part of it, which, the fact that it's undetectable by the PCR test, it's coming to a point to where they're just simply trust no matter whatever we say, no matter what. So can you touch on the PCR test in particular there? What does that mean to you that if it's not detectable by the PCR test, what does that mean? Explain it for the layperson out there.
Let's just make something up. That's what the scientists do. They just say, let's just make up that this is not detectable. I don't know. You're probably the same. I have to see the evidence, the direct evidence of this. How are they saying it's not detectable? I know for what's called one of the main so-called mutations or changes for the B117 variant and some of the other new variants, the UK one, the B117 and others, they say it's something called the N501Y. And that we know that a person has this variant in them because it doesn't test positive. It doesn't register in one of the 3 parts of the PCR test. There's the S gene, the N gene, and the orb gene, I think it is. Don't quote me on that, I have to. And it doesn't show anything on the S gene. So we know it must be the new variant because this, but then you look at the people who wrote the original paper about this it's being negative on the PCR test for us, said it could be other things causing the same thing. So it's just all a flight of fancy. It's been a flight of fancy for months. It doesn't matter. It's like the plane of what their narrative is way divorced from reality, from the ground. So they're just taking the world on this tour of fantasy land.
Right. Or it's not there at all. Like the variant they're talking about, right? The idea is that if you're not detecting, you can't say the lack of detection proves that it's present. It blows me away. But let's bring it back into your article about this, because this is the part that really was unnerving. And by the way, it was also reposted by Off Guardian as well, which I thought was fantastic to see this get even more spread. But so we're talking about the idea that based on these variants we just discussed, the idea that these variants are being sort of plugged in and using them to adapt the current vaccine they're using for the injections they're using for COVID-19 and adapting that to a new version, but without the safety testing. So explain to people just what that means and how they're doing that and why that is an alarming concept.
Well, what they're saying is that, well, we already know that the vaccines are safe and effective, the COVID vaccines, because they know the current crop of vaccines are safe and effective.
Which is, I mean, to say that even off the bat is frustrating to me, and you as well, I'm sure, because they're still currently undergoing safety trials. There's no actual approval yet, but it's just this mindless repetition of safe and effective, right? As somebody recently pointed out, I believe it was a Mexican comedian speaking with Dr. Fauci, is if it's safe and effective, why has it not been approved yet? It's like, oh, it's a process. That was the argument. It's like, what are your thoughts on that, actually, if you happen to see that engagement between Dr. Fauci and that comedian?
No, it sounds amazing.
Yeah, it's just funny because he was given this opportunity to speak with this comedian, and I'm sure they thought that it was going to be like a wishy-washy, why are vaccines great kind of an interview, and it just went the wrong way. And the guy asked all the questions that we're all asking. And it was very clear that Fauci was uncomfortable being put to real questions. One of them was that exact point, but bringing it back to this though. So how is it, how are they able to do this? That they're using the variants to make new vaccines in general. That's the argument, right?
Well, they're saying, well, we need to have new vaccines for the new variants because otherwise we believe that the current vaccines may not be effective against these new variants because of the changes. So we need new vaccines. And because the current crop of vaccines have been, it's Pfizer, et cetera, have been used now in millions of people, and there's very few adverse events, 1 in a million, that we don't need to safety test the new ones because they're just tweaks of the previous ones. And they're saying that also we don't need efficacy testing. We can just put them in people's arms, and they'll let us know whether they're safe and effective. And I just wanted to make one point I haven't written about yet, but a couple of years ago, I went to a session here in Toronto for parents who do not want to vaccinate their kids. And it's the very same message, safe and effective, as we're saying in spades now. It's got to be sponsored by pharma. They have these cartoon characters saying, dismissing any concerns about vaccines, saying they're one in a serious events or adverse events or 1 in a million. We're seeing the same trope just repeated writ large everywhere. So it's nothing new, but now they're using it to have a completely open door to deregulation of any sort of trials of vaccines. And there was a really interesting interview on February 23rd with the head of Pfizer. And he's basically saying that the regulatory agencies went to Pfizer to determine what should be in their guidelines. But that's not new either. We've known, for example, for years that the Food and Drug Administration and Health Canada and everywhere is driven by industry. So this is just the same thing. And now they get to have endless streams of new vaccines for new variants. They seem to be modeling it on the flu, saying the head of Pfizer was saying there'll be one new vaccine, new iteration of each vaccine each year, but we don't know yet. And now, for example, this new twist that we'll talk about shortly, I'm sure, with Geert Vanden Bossche talking about we're going to have a new type of vaccine. So this is like we're in this plane to God knows where and where they're going to take us and which twist and how do we figure out where we're going, never mind where we're going next.
Right. Well, and that we'll get to that next, and that is definitely seemingly like perfectly the next step to this conversation. It's I find it hard to believe that it's not in some way meant to happen that way. But as you point out in the article, the group Access is the discussion. It was basically the acronym for all the different countries involved: Canada, the UK, Australia, Switzerland, Singapore. It's Access Consortium. And in your article, you point out, to your other point, that both the Access and US FDA are recommendations only require that the companies themselves measure the level of antibodies that people produce when they're given these vaccines to then justify whether they're accurate. So again, to your first point, we're letting the companies dictate, companies that have been caught lying about safety and efficacy and any number of things, problems. I mean, from everything you could imagine, most of these companies, Johnson & Johnson, Pfizer, they've been caught lying about this stuff. I just find that staggering that they're allowing them to have that control. But as you also point out, that they're modeling this off like the flu scenario. And in the discussion, they reference the H1N1 pandemic in regard to the flu. And they keep pointing to these past pandemics that even the WHO has called a fake pandemic in the past as something to point to as, look, we did it there and we can do it now today. It feels like they're trying to build this platform, which is what Moderna calls their plug and play, vaccine variant kind of going forward scenario. They're trying to build this infrastructure for vaccines, not based on the evidence, but based on the way they've told us this stuff works. And now we're getting to a point to where we haven't even gotten enough safety trials for these, and they're already talking about pumping variants style vaccines out to keep going forward under the guise of, we're just in so much danger, we shouldn't be doing those things. Right. So what's your biggest issue with this whole point? I mean, what are they missing? What should they be doing? Let's put it that way.
They should be stopping all of this activity immediately, apologizing, going to jail. Where do we start?
Maybe put a finer point on it. Yes, completely agree. What hypothetically should they be doing with this current variant scenario? Like if this was going to be done the way that we were told they were done 10 years ago, what would be the normal process? A new variant pops up and they got to make a new vaccine. We're talking like 5-10 years later, right? Is that how it used to go?
Yeah, but even that is bogus. I mean, we can't. There's no reason to believe that any of the testing is, if it's done by industry. I was a medical journalist for 22 years. I've been to lots of meetings on also infective agents. There's a big meeting called ICAC held every year. I've been to that a few times. I know the pharma industry. I've done work for pharma in the past before I finally saw the light. And so this is not dictated by reality. This is dictated by just industry. And there's so many whistleblowers. A book published maybe 20 years ago by Dr. Chopra from Health Canada said when he was first interviewed in the, I think, 70s for Health Canada, the person interviewing him said, now remember who your clients are. And Chopra said, well, of course it's the public. And he said, no, it's industry. Man. So it was ever thus. This isn't new. So the whole way the trials are set up is bogus. So I don't endorse. We shouldn't endorse any of this. It's very problematic.
Yeah, I mean, the idea that we shouldn't be doing safety testing for our safety is ridiculous. And I've been saying this from the very beginning because that's the guys, right? This is so dangerous that we can't waste time doing this. We just have to trust the science, but it's not really the science anymore. We're trusting the assumptions made by experts that are guided by a lot of other things than just what's best for our interests. Now,
Christian, I mean, these are changing so fast. We have to move really quickly, or else we're all gonna roll over and be really in danger.
Which, by the way, is completely disconnected from the actual facts, the current numbers, and the rate that we're at risk, and on and on and on. But don't listen to any of that. That's the variant could be worse, and so just in case, we already saw countries lock down on the idea that there's a new variant. Oh, did anything happen yet? Well, no, but just in case, right? So we're willing to increase teen suicide by 100% and destroy everybody's businesses, right? Just in case. Like we are lost in this argument that it's for our safety. Now, before we jump over to the next discussion, in interest of time, you mentioned some red flags in this article in general, and I just wanted to get your thoughts on some of these red flags. You mentioned they don't address the fact that until 2020, scientists were unable, and this is one that I keep making, they were unable to develop any effective vaccine against coronavirus despite decades of effort. Then suddenly they were able to create 7 in the same time. So what are your thoughts on that? I mean, that is, I don't know why people don't recognize sure, coincidences happen, but 7 at once, all on the same agenda.
Yeah. And we've been interacting with coronaviruses for millennia. Our bodies have done just fine. We do have a very, very amazing, sophisticated immune system, both immediate and longer term, and they work very well. And that seems they've supplanted that idea in our minds, in the public consciousness, by no, we just can't possibly defend our own bodies. It has to be done by the biomedical and pharma industry.
We've already seen them changing definitions, right? Herd immunity, vaccine. We're watching them change these as we go forward, which speaks to exactly that, right? Is they're just trying to evolve the definitions. But you also point out that they have no references, so it's hard to check what they're doing, which is exactly how this seems to be going forward in general, right? We'll just trust your authorities, right? Trust that we have your best interest at heart. And historically speaking, that's almost never the case. All right. Or what about viral resistance? Speak on that for a moment, and then we can leave it there and we'll jump over to the next conversation.
Sure. Well, yeah, I talk about the fact that they don't address at all the idea that viruses do change. They don't change as quickly as bacteria do in response to antibiotics, but there is the possibility of change. So how are they going to, there's could well be the way they've set it up. It's just not going to work because there's going to be some pressure for the virus to change. So then the new variant will become the new variants, and they'll have to have new vaccines for the new variants, and
which seems to be the point.
Cycles.
Right? Yeah. It's self-fulfilling prophecy, and this does beg the question about whether that is either, this is a valid question about whether it is even actually happening or whether they are creating them themselves, whether inadvertently or intentionally. It's an interesting point to make, which sort of brings us into this next discussion, which you wrote about today. Or technically, I believe it was yesterday, but in any case, it was recent.
This morning, yeah.
This morning. Okay. The curious case of, and please pronounce his name again for me.
Geert Vanden Bossche.
Yeah, I'm sure I won't ruin that.
My mom was Dutch, so I have some. But he was Belgian, I think. He's Belgian.
Well, this is a really, and it's just like you write about in the article. I have been getting this incessantly. People sending me this because they're interested, right? And rightly so. I ask them, send me whatever you think is interesting. And I would say maybe most of them probably just saying, what do you think about this? Because I'd like to believe that I've cultivated an audience out there that's very skeptical of anything, even things that seem to go along with what we believe. But it's easy. And I want to say off the bat, I don't know how I feel about this. I don't know whether this guy is somebody who is doing what he thinks is right, and it seems to be sort of bolstering without people seeing it, the main narrative, or it's part of an agenda here. But I'm very skeptical because, as you point out, this guy's argument seems to bolster the majority of sort of this vaccine infrastructure, while on the face going, we shouldn't be doing this and this vaccine's dangerous, which is like everybody like us is going to go, oh, fine, a educated PhD saying that this is dangerous, except we missed the background part of it. So would you explain that for me? What is he arguing? And why is there behind the scenes? Is it kind of alarming for you?
Well, here's a fellow who's affiliated with the Gavi, which is a vaccine alliance created in large part by the Bill and Melinda Gates Foundation. He's been affiliated with the Bill and Melinda Gates Foundation directly. And that's in his in his CV. And he has his own vaccine company. So somebody who makes vaccines is going to tell us about the dangers of vaccines right away. That's a conflict of interest. His credibility is just, you can't really take somebody like that seriously. So now he's saying that, well, the problem with the current crop of vaccines is there's going to create this immune escape. There's going to be such pressure on the virus that's going to keep changing, and our poor immune systems just can't possibly keep up, and it'll escape. And so what we need to do is pivot and have this whole other type of vaccine. The solution to this wrong type of vaccination is a new type of vaccination of everybody in the world, and this will be to stimulate another part of the innate immune system, I believe. The innate, called natural killer cells.
Right. So his point is that the mRNA mass vaccination is what we shouldn't be doing. That's going to create the new variants and create the super, like where the people. The argument is essentially that these people that will be vaccinated could essentially continue to spread this, or at least that's what the adaption of this discussion has become. But this is what makes me so alarmed is that he's basically saying that we should be mass vaccinating people, but just not with this one, right? Because this is the dangerous one. And is that specifically because of the mRNA technology? Is that his focal point?
Well, he's saying that all of these vaccines, the current type, whether it's mRNA and others, they stimulate some of them stimulate the production of more virus, or some of them stimulate production of antibodies to it, and that'll just causes such a pressure on the virus either way that it's going to mutate, and it will escape all sorts of any mechanisms mounted by the body to defend against it.
Yeah, see, and so you could see where I feel like there should be an inherent skepticism to this, but the problem is that people read the surface of it where he's saying that this is dangerous, that we shouldn't be doing this vaccine. It'll lead to a super infectious virus, is how he puts it. But I don't see that. I don't get why this is being discussed in such a broad way. Now, like, for instance, you point out that Del Bigtree and a few others are discussing this. In no way do I want to, I feel like they're doing great work in a lot of this discussion. But I do question why it was taken so quickly in that way. But it could just be for the same point. It could be that they are simply looking at this and going, okay, this is an expert who is arguing that this is a dangerous thing we're doing. So at the first step, it could still be used to point out to people that the narrative is wrong. You're being lied to. But I think your article makes it clear. You feel this is sort of a Trojan horse, right? That it's coming in to make that argument, but then just kind of pivoting over to a different vaccine that is equally as alarming. Is that how you see it?
Well, he's not even a Trojan horse. He's coming in showing exactly who he is. He works for, he's a big vaxxer. What he does is make vaccines. He's been affiliated. He likes vaccines. And he makes all sorts of basic errors about the immune system, saying, well, there's these things called natural antibodies that are produced right off the bat, and they're quite weak and feeble, but they're a major part of our defense. They don't work well, so just the antibodies that are produced later also will be overwhelmed by all these vaccines and all the new types of viruses. So. But if somebody just quickly, you take 1 minute or 1 second, as I always say, and look online and look at natural antibodies, there's very little about them until the last year. And you'll find that they're a very small part of the immediate defense of the body. So it's all specious. It's not true. And it's easy to check. He makes all kinds of errors right through it, and it's predictable. And if you look even who he is, where was Geert Vanden Bossche for the last year when a lot of people with strong qualifications are going, there's something fishy here. And who is this fellow, Philip McMillan, who's interviewing him? If you look him up, and again, very quickly, you can see he's a specialist in dementia. And if you look at his company, Vyjon Health, which is listed on the kind of the title slide of this video, it's a company that's dormant. So that's why I say, well, I wonder if this is just an AstroTurf drug company AstroTurf campaign. They pop up this expert in vaccines who, for some reason, people who should be skeptical of him say, oh, he's a vaccine expert, we must believe him. So and all of a sudden, this fellow Philip McMillan, who's has no knowledge of vaccines, interviews him, and all of a sudden, within days, it's everywhere. That doesn't pass the sniff test. And so, what is going on? I think it's important on our side to be our own, if you will, information and misinformation immune system. We have to, if there's information that's not correct, whisking around, we have to stop it. We have to be critical of our own side, or else it is a big Trojan horse already. We'll swallow this complete cod swallow, and it'll kill us.
Yeah, I agree. The good point to make there, and these are kind of things that I would argue people like us probably pick up on. And it doesn't have to mean that it's guaranteed, right? When these things happen, it doesn't mean it's automatically fake, but there are things that do stand out, which is something like we just talked about, where all of a sudden, in the process of 3 days, I get 35 emails from different people saying, have you seen this? Look at this. And it always stands out to me. Why is that all of a sudden such a big thing? But more than that, there's usual people that tend to reach out and send stuff. It's when you get all these new emails from people you never heard from before. Never. All of them. Look at this. And so you start going, why? Why are they so motivated to reach out to me personally when I've never even heard from them before? And those are doesn't guarantee, but those are things that stick out to me. Now, you make interesting points. And to go back to the first one you made, I can't even believe, to be honest, that this is something that's being discussed, seeing as how this is a person who is associated with Bill and Melinda Gates Foundation, with Gavi. or GlaxoSmithKline. It's kind of like, that is interesting that that's not being given a lot of concern. But to your other point, and this is what I found really, really telling. You wrote, it's in his open letter. He writes, I can assure you that each of the current vaccines have been designed, developed, and manufactured by brilliant, competent scientists. Now, you could even maybe argue that that's true, and these scientists are being manipulated to do something they don't understand, or however you're going to look at it. But I think we can all recognize that there's a lot of very valid discussions being had, as you point out, about the efficacy, about the safety, about the adverse events, and why that's being kind of just glossed over by somebody who is clearly concerned, or at least pretending to be, about the vaccine dangers, right? I mean, that's a big red flag, as you argued.
Yes, but he coats it all in this, well, I'm risking my whole career for this, and I've done this in a hurry, and I have the best of intentions because we have to stop this disaster that's going to destroy the world and within a very short period of time. So I guess because he makes it sound, which to me is obviously propaganda. It's trying to make people's really thinking mind disappear and just go into flight and why believe you mode. And so I guess under that he can just say things that otherwise wouldn't pass muster at all.
Yeah, I mean, that tends to be the case when you want to get you emotionally plea. This is. And because people go, oh man, he's risking a lot. Well, but I still want to argue that it seems, based on how this has gone forward, it in my mind, it seems just as likely this is somebody who may believe he's doing the right thing. I'm with you. I tend to err on the side of it seems a little fishy. All I'm saying is that I can't prove that that's the case, right? But I do feel that this stands out as a very suspicious event. And what is happening is only serving, even if he believes that he's doing the right thing, which I honestly don't, I don't think that, but that seems to be a possibility. Even if he thinks he's doing the right thing, is leading people into more trust of authority in regard to the same thing that's been happening right now in regard to vaccines and how it's going forward. That doesn't make sense to me. It just doesn't, because based on every reason we have right now to believe not only that the actual technology, or whatever word you want to use around how they make vaccines, is alarming. There's a lot of history around these pandemics in the past, or the manipulations of them, or the reports by the WHO or HHS calling out the CDC for manipulating numbers on these things, and so on and so on. So I just don't know how it can be possible that we can just step out of this obviously dishonest and manipulated scenario into just that one was bad. Trust everybody else though, right? I'm never going to buy something like that. It screams dishonesty to me.
Yeah, so it is a puzzle why people are just repeating this. And
well, to your other point too, why larger entities would do so with very limited skepticism. I do question that as well, and I think that is something that we should be pushing back against. Absolutely.
And then I got an email from somebody from Children's Health Defense, their website, saying we're going to repost your article today. Is that okay? And I said yes.
Good.
But I said it would be, I don't know if I should say this on air, but I said you also should put some sort of qualifier on their breathless coverage of the Vanden Bossche letter that they posted yesterday. Yeah, it's
well, but
they guess somehow a lot of people made what I think is a really big mistake.
Well, and I actually agree with you, but I think what I think again goes back to maybe these people are choosing to take that first point, which again seems like a trap to me. But to say, yes, see, the government's lying. Even he thinks it's dangerous. Even somebody who thinks that we should be doing vaccines, you could see why that point could be made. But I'm with you on the idea that we don't need that, right? There's more than enough evidence to suggest that these things are alarming in their own right than somebody coming out within to argue we should be using them, but just not this one. So I definitely see that.
And isn't that the basics of, when I read a book, when I read an article, you have to look at, are they giving me this sweet message I want to hear so they can, their real agenda is this real bomb they're trying to pass off, and it's completely wrong and deleterious. And this is an extreme example of that, where the nice part is, okay, it's big, but the rest is not even a hidden bomb. It's just completely like, you've got to be kidding me.
Yeah. It's definitely interesting. I mean, that's again why I was resistant to even talk about this until now, because there was something that just felt wrong about it. It didn't seem to align with where this is all going, But to the credit of Children's Health Defense, the fact that they are now posting that article, it does continue to show you that this is what I always look for in any outlet or any researcher, is that there's somebody willing to adapt their opinion based on the flow and evolving of the information. That's all we can ask for, So that's important. But going forward with this, where do you see this going? I mean, you're obviously alarmed about what he's saying and about the variants and how it's going with these vaccines. And this seems to be weirdly taking some people over to the argument that these vaccines should be done just in a different way. You know, where do you see it all going? Do you see people pushing back against this, or what do you think?
I don't know. Somebody who responded to my tweet about the article said that there was something which preceded Event 201 called Clade X. Mm-hmm. And they said that in there, but this is something I haven't checked, but they said this, yes, that they said there would be this new twist with a whole new approach to vaccination against this virus, and that's where everything would swing. So that's interesting. Is this just their pre-developed plan? I have to look at Clade X. I'd never heard of it before.
Oh yeah, we've written about it. It's been a long time since I've gotten, probably maybe middle of last year. But that's an interesting claim to look into, because if it is the case, it wouldn't surprise me at all. Or look at things like Crimson Contagion. You know, these are all exercises, simulations that ultimately ended up becoming the reality. You know, just like with 9/11 and all these other ones we've seen before. But that's very interesting, because I would absolutely argue that the entire point of where this is all going back to the mRNA. I don't know. I mentioned that, but I don't know if you're familiar with what Moderna has on their website in regard to how these things are, how the future of this system is going to work. And this is, I'm going to see if I can just grab it really quick. Let's see. I think this is the one right here. Here we go. Talking about their platforms. And this is, and if you haven't seen this, maybe you can give me your thoughts on it, because this seems to be exactly what they're using. Their mRNA platform. And as it says right here, we set out to create an mRNA technology platform that functions very much like an operating system on a computer. It's designed so that it can plug and play interchangeably with different programs, not being the variants, right? That's how this was designed. So I argue that the whole point of this, as you can see here, on January 11th, Chinese authorities shared the genetic sequence. 2 days later, they were already moving towards clinical trials with what they made. Right. So it was obvious that they had this platform made. They got genetic computerized on a computer screen, and they pumped it into their and they pumped out their vaccine. So you could argue, and I very much think this, it's not that they're building towards this. This is what we did. This is what they had set, which speaks to foreknowledge, which speaks to a lot of things. So maybe if you hadn't seen that, what are your thoughts on it?
Yeah, that isn't the same timing also that the Drosten paper on PCR it took a day or something for it to be peer reviewed and then published about this is how PCR testing should be done around the world. That's amazingly quick. We must live in a different space-time continuum than we do, because it doesn't really work very well. Yes, it obviously is. Can I mention one thing? Maybe it's very strange, but
feel free.
2 summers ago, I was biking home from a meeting, and I was just at a major intersection, and the cops stopped us, and hundreds of big black SUVs and cars whisked by. It took at least 5 minutes. I would have whipped up my camera, but I just thought it would keep, and it didn't stop. And so could we suppose that there have been meetings? I don't know if that was for this or something else that we never heard of, that a lot of people get together, do a lot of planning, at least a year in advance, and figure this out, because this is a pretty intricate, you don't need obviously everybody involved to get together, but you're going to be having some major players, and you lay it out, and then everybody below them kind of follows through.
Yeah, this is one of those things it's really insulting to our intelligence. The mainstream tries to push that, you know, you argue that it's possible that powerful people get together behind the scenes and discuss how they can better their standing at the expense of other people. Like, that's just crazy, right? That's conspiracy theory. That is every single day in this country. You know, so the argument that these people have gathered at things like these different, you know, whatever groupings you think out there, there's classic ones we've talked about, Bilderberg and whatever else, but there's a continual collection of people, the unelected power structure, including journalists and heads of state, which they're not supposed to do, by the way, that gather behind the scenes and discuss the future of our society, right? So the idea that Event 201 is exactly one of those things. They discussed this, they gathered it, they planned it, and now it's happening, right? But the fact that we can't connect those things because of the term conspiracy theory is just insulting to our intelligence. They did this, and it absolutely happened. And to your point about whether that is what that was, I mean, I can't know whether that was that, but we know that is happening beyond a shadow of a doubt. The question is whether or not what they discuss is actually making it as policy. And I think we can look at something like Davos or any number of those events where they do. they openly discuss what they'll be rolling forward, you know? So, and we also see them discussing these things in a much grander scale. Like, you know, the whole idea of the Great Reset is something they've been discussing for a really long time, involving the idea of nanotechnology and the converging of these different technologies, right? So when I discuss something like this and a platform for mRNA technology and pumping in new variants and pumping out new and all of these using nanolipid particles and the whole thing going forward, it begins to feel a little bit organized. Call me a conspiracy theorist.
I think I'll call you a conspiracy theorist. A smart guy.
But, you know, I mean, I know in the interest of time, there's plenty more things we could probably talk about, but let's leave it, you know, at the end of the day, what do you think is the most alarming part about this? Is it ultimately the vaccine, or is it where the vaccine is being led to, like, you know, the control mechanism around it all? And what do you argue people should be doing out there to push back against stuff like this?
I guess the most alarming part is that they can be so divorced from reality and move this thing any direction they want, and have so many people who I would think have some ability to critically think, just take it in. That's quite alarming. I think we need to all, even our own people, we need to treat with skepticism. We have to ask ourselves, who is writing this? Follow the money. There's big money involved, and that will tell us a lot. And to not really believe somebody who says, well, our own immune systems don't work and we need this whole other set of vaccines. It has to stop somewhere, and we each have to be part of that defense and say no, and to try to push back, and hopefully people can take the time to get a little bit of scientific and medical literacy, and to be able to look at themselves rather than saying, oh, I can't possibly understand this. I have to trust somebody else, and I will give my absolute trust to fill in the blank, whether it's public health officials or some person whose show they like. I think we have this capacity to think for ourselves, and to have the confidence to do that. And the more people who do that, I think we're all going to be better off. Yeah, well said. That's exactly the point. I mean, we've been convinced, or some people have been convinced, that they are just not capable of understanding or doing this or researching or applying critical thinking, as the New York Times argued was the problem. Unbelievable how we've gotten here. The point is, you are capable. Everyone out there listening, you're capable, you're able. The point is, you just have to have confidence in yourself to go out there and do it. And yeah, there are plenty of things you'll stumble across that you might think, I don't understand. Well, you know what? Take a minute, look it up, research it, begin to understand it, you know, and then if you feel like you still need more, then reach out and look at other people, including mainstream, and collect it all and come to your own conclusions on it, right? That's what they're trying to stop us from doing, that because they know that you thinking for yourself is that is the solution to stopping what they're doing. The moment that we all start thinking for ourselves and researching, it's going to be much harder for them to actually float these really ridiculous concepts. So thank you so much for being here today. Hopefully we can reconnect as this goes forward, and I look forward to reading more of your work. Great talking to you. Likewise, Christian. Thank you. Anything else you wanted to leave us with today? Your social media links or anything that we can see coming from you in the near future? Sure. My main is rosemaryfrei.ca, ROSEMARY, F as in Frank, REI.ca. That's my website, and it's got links to my Twitter, which is at Rosemary Frei TO, and I'll be putting in an RSS feed as well. So, but mainly my website. Awesome. Awesome. Corbett and I just talked about RSS feed, so it's good to hear. Right. Yes. Right. Okay. Thanks. Well, thank you so much for being here. And as always, everybody out there, question everything. Come to your own conclusions. Stay vigilant.